therapeutic stance, attitude of warm support, empathy, supportive working environment. Therapist active and serves as a patient advocate, focus on the current problems. Therapist conveys optimistic attitude about patient's recovery. So it says current problems, and again, this is really antithetical to kind of an analytic perspective in terms of just really focusing on the past. But obviously in IPT, what we've just done is we've just reviewed all the past, and we have this history that we've conducted an interpersonal inventory that you freely draw on in terms of continuing to elucidate the patterns and the connecting points and the reminders, you know, and because then in my mind, and one of the things I've always really liked about it is that I always view the world in a much more existential way, and to me it feels like this real moment existentially in treatment where, like, here we have all this data, here we have these issues, and here you have these choice points about how you want to continue to, you know, live and construct your life, you know, and based on all of this collaborative data that we've gathered, I think that if we focus on this, it's going to really help help reduce your symptoms. But it really is a freeing, opening up opportunity for them to be, you know, again, making choices based on data, you know, and based on kind of this data that you've collaboratively worked on. Yeah, focusing on transference shifts focus away from treatment to the patient's, focusing on transfer shifts the focus of treatment away from the patient's current and personal problems. Now, transference focus transfers the orientation of therapy towards intrapsychic insight rather than improving social support and interpersonal functioning. The only caveat here is that even though you're not really working with transference, with interpersonal deficits, you are using more of your experience base with the patient in the moment. Mm-hmm. And obviously some would perhaps suggest that therein lies the potential problem of transference. But then, what's it like working with me? What's it like doing that in here with me? What's it like sharing with me? This is the first time you said that with anybody. What's that like talking with somebody like that? Well, I mean, certainly that could potentially evoke, a transference relationship, but I'm not interpreting it like that somehow or other you view me as a parental figure or you view me as some significant other, so it's not that, but really what you're doing in those, with the interpersonal deficits, it'd be just like what you would do, like, I'm really having a hard time understanding you. I'm really having a hard time understanding what you say sometimes. When I ask you a question, it seems like you have a tendency to deflect and not really, kind of address what's going on. Does that happen for you in other relationships? Have you ever got any feedback about this? Has anybody ever said that to you? So it's really my giving you clear feedback about a particular issue and deconstructing it and proposing perhaps a hypothesis about it and then thinking through what would be a potential solution. But again, it's not transference, but it's really working in the context of the, it's really, again, that idea that we've all been trained to do is how to use your relationship as an intervention strategy.
So you